The most terrifying thing about high blood pressure isn't the number you see on a digital screen in your bathroom. It is the silent, invisible way it chips away at the life you have worked so hard to build. I see it every week in my clinic. A patient comes in, feeling perfectly fine, only to discover that their body has been weathering a storm for years. The fear I see in their eyes isn't just about a heart attack. It is the fear of losing their independence. It is the dread of a sudden stroke that takes away their ability to drive, to garden, or to pick up their grandchildren. If you are over the age of 60, you are likely living in a state of constant medical confusion. You hear one thing from the evening news, another from your neighbour, and something completely different from your primary care doctor. You are told that your numbers are too high, and then you are handed a prescription for a second or third medication that makes you feel dizzy, tired, and just plain off. You start to wonder, is the treatment worse than the disease? And more importantly, is that number on the machine actually dangerous, or is it just a normal part of getting older? I am Dr. Carter, a board-certified physician who has spent years helping patients navigate the complicated world of cardiovascular health. My goal today is to give you back your peace of mind. We are going to cut through the medical jargon and the conflicting headlines. I am going to show you exactly how high is too high, and I will let you in on a secret that most clinics do not have the time to explain. The target number for your health is likely not the one you have been led to believe. By the end of this video, you will know how to distinguish between a reading that requires a deep breath and a reading that requires a call to your doctor. We are talking about protecting your brain, your heart, and your freedom as you age. To understand where we are going, we have to look at where we started, because the history of blood pressure medicine is full of dramatic shifts that have left patients caught in the middle. For decades, the medical community followed a very simple, almost primitive rule. We were taught that a normal systolic blood pressure, that top number, was simply 100 plus your age. Think about that for a moment. Under that old logic, if you were 80 years old, a blood pressure of 180 was considered perfectly normal for your stage of life. We now know, through years of clinical data and heart health outcomes, that this old rule went way too far. Letting blood pressure sit at 180 is like allowing a fire to smoulder in the walls of your house. Eventually, it is going to cause structural damage. However, in our rush to fix that old mistake, the pendulum swung to the opposite extreme. We entered an era of aggressive overtreatment. We started treating every 70-year-old as if they had the arteries of a 20-year-old athlete. We began pushing for a universal goal of 120/80 for everyone, regardless of their medical history or how they felt. The problem is that medicine is not a one-size-fits-all equation. As we age, our physiology changes. Our arteries naturally lose some of their elasticity. They become a bit stiffer, like an old garden hose that has been out in the sun. If we try to force the pressure too low in a body that has adapted to a slightly higher baseline, we run into serious problems. I've seen countless patients who are over-medicated to hit a perfect number on a chart, only to end up suffering from debilitating fatigue, brain fog, and dangerous falls. The truth lies in what I call the Goldilocks zone. It is that sweet spot where the pressure is low enough to protect your brain from a stroke, but high enough to ensure that blood is actually reaching your vital organs when you stand up. To find that zone, we have to stop looking at blood pressure as a fixed, scary number and start looking at it as a living, breathing part of your daily life. We have to understand the difference between the peak of a wave and the steady flow of the tide. In the next section, I'm going to break down what those two numbers on your monitor are actually trying to tell you about the state of your heart. Before we dive into the specific thresholds, we need to pull back the curtain on what these numbers actually represent. Every time you wrap that cuff around your arm, you are eavesdropping on a conversation between your heart and your arteries. But most people are only listening to the volume, not the message. The top number, your systolic blood pressure, is the peak of the wave. Think of it as the maximum force your heart exerts against the walls of your arteries every time it beats. It is the squeeze. As I mentioned earlier, as we age, our pipes, our arteries, naturally get a bit more rigid. It is a biological reality. Because those pipes don't stretch as easily as they used to, your heart has to work a little harder to push the blood through. This is why a rising top number is often a normal adaptation of an aging body, not necessarily a sign of impending doom. Then there is the bottom number, the diastolic pressure. This is the pressure in your arteries when your heart is at rest between beats. If the top number is a crashing wave hitting the shore, the bottom number is the steady pull of the tide. It represents the constant background tension in your vascular system. While the top number tells us about the power of the pump, the bottom number tells us about the health of the pipes themselves. If that bottom number stays high, even when the heart is relaxing, it means your arteries never get a break. They are under constant, unrelenting stress. Understanding this distinction is vital because, in older adults, these two numbers often start to move in opposite directions. You might see your top number go up, while your bottom number stays the same or even drops. This is what we call isolated systolic hypertension, and it is the most common form of high blood pressure in people over 60. If you don't understand this, you might end up chasing a bottom number that is already low, which can lead to over-medication and that terrible feeling of lightheadedness when you stand up too fast. Now let's get into the heart of the matter. What are the actual numbers that should trigger action, and which ones are just noise? I want you to think of blood pressure like a traffic light system, especially once you have crossed the age of 60. If your systolic pressure is consistently below 120, you are in the green zone. That is the gold standard, the ideal. But let's be honest, for many people in their 60s, 70s, and 80s, hitting a 120 every single day without feeling like a zombie is a tall order. If your numbers are sitting between 130 and 139, you are in what I call the zone of safety. For an active, healthy 65-year-old, this is often perfectly acceptable. In fact, if you feel great, have plenty of energy, and your kidneys are healthy, I rarely see a reason to jump straight to heavy medication in this range. The yellow light starts flashing when we hit the 140 to 149 range. This is the area where we need to pay attention, but we do not need to panic. This is the time for a conversation about lifestyle, salt intake, and stress management, rather than an emergency trip to the pharmacy. The red light, the point where I truly become concerned, is when your resting systolic pressure is consistently at or above 150, or your diastolic pressure is consistently 90 or higher. This is the action threshold. When you stay at 150 over 90 or above, day in and day out, the risk of structural damage to your brain and heart becomes too high to ignore. However, there is a catch. These numbers only matter if they are your true baseline. If you are 30 or 40 years old, the rules are stricter. At that age, we want to see you below 140 over 85. But for my older patients, we allow for that extra cushion because we prioritize quality of life and the prevention of falls. The biggest mistake I see people make is what I call the reactive trap. They take their blood pressure once, usually after a stressful morning, see a high number, and spiral into a state of anxiety. That anxiety then drives the blood pressure even higher, creating a dangerous feedback loop. You must understand that blood pressure is not a static number like your height. It is a dynamic, living metric. It is designed to fluctuate. If you are chasing your dog around the backyard, or you just finished a heated discussion about politics, your blood pressure should go up. If it didn't, you would faint. That is your nervous system doing its job. I have seen healthy patients spike to 160 systolic just because they were rushing to make it to their appointment on time. We call this reactive blood pressure, and it is a normal physiological response, not a disease. I tell my patients all the time, I don't treat spikes. I treat patterns. Think about it like the stock market. If you look at the price of a stock every 5 minutes, you will go crazy watching the ups and downs. But if you look at the average price, over a month, you see the real trend. Your blood pressure is influenced by everything. A full bladder can add 10 to 15 points to your reading. A cup of coffee, a cold room, or even just talking while the machine is running can skew the results. This is why a single high reading at the doctor's office is often meaningless. We need to know what your heart is doing when the world is quiet and you are at peace. To get that information, we have to stop guessing and start measuring with a very specific clinical protocol. In the next section, I'm going to teach you the exact 7-day method I use with my own patients to find their true, honest baseline. Part 6. The Gold Standard Measurement Protocol, Since we have established that we are looking for patterns, not spikes, the next logical question is, how do we capture an honest pattern? Most people measure their blood pressure incorrectly, and as a result, they are making major health decisions based on bad data. To get what I call the Dr. Carter baseline, you need a protocol that removes the noise of daily life. First, let's talk about the equipment. If you are using a wrist cuff, I want you to reconsider. While they are convenient, they are notoriously sensitive to body position and often provide inconsistent readings. For a clinical grade baseline, you need a reliable upper arm cuff that is properly sized for your arm. If the cuff is too small, your reading will be artificially high. If it is too loose, it will be too low. Now here is the ritual. You must sit quietly for 5 full minutes before you even press the button. This is not the time to check your emails or watch the news. Sit in a chair with your feet flat on the floor. No crossing your legs. Your back should be supported and your arms should be resting at the level of your heart. Most importantly, make sure your bladder is empty. A full bladder is a physical stressor that can send your systolic number up by 10 points. Do not talk. Do not scroll through your phone. Just breathe. After 5 minutes, take your first reading. Then, wait 60 seconds and take a second reading. You will often find the second reading is lower because your nervous system has finally settled. Write down the lower of those two numbers. I want you to do this twice a day, once about 20 minutes after you wake up, before you've had your coffee, and once right before you go to bed. I also recommend alternating arms. Do the right arm on Monday, the left arm on Tuesday. Do this for 7 days straight. At the end of the week, you will have 14 readings. Average those numbers. That average is your true baseline. If that average is consistently above 150 over 90, then we have a pattern that requires a professional medical strategy. While numbers are important, they're only one part of the story. As a physician, I'm not treating a machine. I'm treating a human being. There are times when the numbers might look acceptable on paper, but your body is sending out a distress signal that we cannot ignore. I lower my threshold for concern immediately if you have certain pre-existing conditions. If you have chronic kidney disease, a history of a stroke, or existing heart disease, we cannot afford the luxury of a cushion. In these cases, a reading of 145 is no longer a yellow light. It is a red light that needs intervention to prevent further organ damage. Furthermore, you must learn to listen to your body's internal check engine light. If your blood pressure is sitting at 140, which we previously called the safety zone, but you are suddenly feeling winded after walking to the mailbox, that is a red flag. If you are experiencing new chest tightness, persistent headaches that won't go away, or a strange sense of brain fog that seems to correlate with your heart rate, do not wait for the numbers to hit 150. We also look at something called delayed recovery. If you go for a walk and your blood pressure spikes, which is normal, but it stays elevated for an hour after you've sat down to rest, that tells me your blood vessels have lost their ability to snap back. That lack of flexibility is often more concerning to me than the high number itself. The bottom line is this: the numbers provide the map, but your symptoms provide the weather report. If the weather looks stormy, we take action, regardless of what the map says. I know that dealing with blood pressure can feel like a heavy burden. It feels like a sword hanging over your head, and the constant pressure to get the numbers down can suck the joy out of your golden years. But I want you to remember the goal. We aren't chasing a number just for the sake of a chart. We are protecting your ability to live your life on your own terms. We want to keep your brain sharp so you can keep making memories. We want to keep your heart strong so you can keep staying active. Understanding your blood pressure is about reclaiming control. It's about moving from a place of fear and panic into a place of informed, calm action. If you find that your 7-day average is indeed too high, do not despair. Medication is a tool, but it is not the only tool. In fact, for many of my patients, we have seen incredible success by focusing on the nervous system, sleep quality, and simple movement patterns. Now that you know how to measure your pressure, and you understand which numbers actually matter, your next step is to learn how to nudge those numbers back into the green zone naturally. I have developed a strategy that takes just 10 minutes a day and can help lower your baseline without the side effects that come with a pharmacy bottle. I've put all of that information into a follow-up video, and I highly encourage you to watch it next. Your health is a journey, not a destination. Take a deep breath. Trust the process. And remember that you are the most important member of your own medical team. I'm Dr. Carter, and I'll see you in the next video.